So today we're going to go over disaster preparedness for healthcare workers and caregivers. So we know that hurricane season is approaching. Well, it's actually here, and I think we probably have in a couple of days we'll most probably have our first named system. I'm not predicting anything, but with the way things have been going, we just want to make sure that we are prepared. And even though they give us, a little heads up, we still can never be prepared enough. So what is a disaster? A disaster is any event that significantly disrupts the functioning of a community or service. For healthcare, it may involve overwhelming patient loads. So you might have more patients, depending on what setting you're working in. Equipment failure, you might experience some power loss or a threat to life. And some examples of this is hurricanes, which is most common around here, floods, also another common, fires, and pandemics. So in disasters, medication access can be delayed. Always document the medications are given and when. Know where emergency meds are, like EpiPens, insulin, oxygen tanks. Know where they're stored. So there's a few different types of disasters. Disasters fall into these categories. So there's natural, which is, weather-related events, things we cannot control. And then there's man-made, which are things that are intentional to harm, like active shooter or things like that. There's technological disasters when you experience like power stuff. So power or IT system failures where you're not able to access what you need to access. There are biological, which is like pandemics and infectious outbreaks. So sitters and aides may be the first to witness the impact on vulnerable patients. So make sure you alert the nurses immediately. And this is because you probably spend a lot more time with the patient versus, the doctor or another healthcare person. A delay in recognizing disaster signs like an emergent infection can cost lives. So make sure you communicate those things early. Why healthcare workers must be prepared. Well, you are the frontline worker. The patients look to you for safety. Sometimes sitters often remain with the patients longer than anyone else during a shift. So you're expected to act calmly, follow protocol, and protect the patient. Even small actions, keeping the patient covered, speaking very calmly, in a calmly manner. So in 2021, there was a Texas freeze and over 100 hospitals lost water or heat. So the staff that was on site had to sleep in hallways while still caring for patients. Every facility has an emergency plan, so make sure you know where the EOP, the emergency operation plan is, know where to find it. Know your chain of command, and that reduces like confusion. If you know where to go, who to follow, then that's less confusion for you. Never act on your own during a disaster, so make sure you report, you confirm it. You want to make sure you confirm it first and follow the protocol. So this is just a little step by step in case of like a fire. So every disaster should have like a protocol or things that you follow. So I just listed this example here where we usually go by, which is RACE. R, which is rescue those in immediate danger. A, alarm, pull the fire alarm and call it in. C, confine. You want to close doors. E, extinguish and evacuate. Only if trained and safe to do so. So make sure you know your limits. You don't want to go do something and then put yourself at, in more danger. Roles of sitters during disasters. Make sure you are keeping calm. Use a soothing voice and limit stimulation. You don't want to do nothing that's going to hype the patient up and get them agitated. Stay with your assigned patient unless directed to move. Please don't ever leave your patient. Report anything unusual. Breathing changes, confusion, pain. You want to make sure you avoid panic, so your calm is part of their treatment. And here's another tip. Ask nurses if any meds need to be prioritized, like those important things: seizure meds, insulin, EpiPens. Assist by alerting when the patient is due. Personal preparedness for staff. You can't help others if you are unprepared. Prepare like a to-go bag, change of clothes, personal meds, charger. Please make sure you have your charger. You don't know what the situation is going to be. They might be out of power. So I would say make sure your device is charged at all times, but also make sure you do bring a charger with you. Water, an ID to be identified. Have a family plan, like who picks up the kids? Where do the kids go? These are things that we should be discussing with our families anyway. I mean, anything can happen at any time. And just the way that the climate has been changing and everything has been going, you just never know. We had a freeze here. We had snow. Like we had real snow. Normally we have like little flurries or ice. We have ice. But we had snow. So you never know how things can quickly change. So you want to make sure you're having these conversations with your family as well. Like where will you go? Who will pick up the kids? Things like that. Make sure someone knows you're working and may not come home quickly. So after Hurricane Katrina, many staff had no plan for their families. Some left work early, compromising patient safety. But this was something that was kind of new to me. And what I mean by new is that, we know when to expect hurricane season. We don't always know when to expect a hurricane unless the news predicts something. But Katrina was like one of the biggest that I remember, that I was, young enough or old enough to remember. And apparently, a lot of us didn't prepare well because we thought that it wasn't going to be as bad as they said. So there was no plan. So make sure you do have a plan or something, in place for yourself and for your family. Infection control during disaster. So your PPE, your personal protective equipment, saves lives, saves yours and your patients. In outbreaks, isolate symptomatic patients early. Wash your hands frequently. Even if you have gloves on, wash your hands. Follow posted signage for contaminated zones. So, for example, if there's an infectious outbreak, you want to identify. So, does the patient have fever? Were they coughing? Did they have diarrhea? Did you notice any rash? You want to isolate them. Place a mask, close the curtain or the door, confine them to a room. You want to inform the nurse or infection control person, or call the physician. Protect. Wear your gloves, wear a gown if you have one. I would suggest that if you're working in patients' homes, have you a backup bag, like with a change of clothes, a gown, mask, gloves, sanitizer, something that you should be carrying with you at all times. Psychological first aid and compassion care. Many patients feel fear and confusion during disasters. So make sure you're speaking clearly. Use simple language. Sit with them if safe to do so, and ask What can I do to help you feel safer right now? In disaster zones, calm communication can lower the patient heart rates and reduce their panic behavior. And I like to include like some statistics here. So this is just a weather and climate disaster from last year about the weather and climate disasters statistics and what happens in the area and what's the percentage. So we know that New Orleans, the metro area, has a high flood risk. So a study indicated that nearly 80% of hospitals in the New Orleans metro area are at risk for flooding from a Category 2 storm, impacting nearly 3,500 beds. So on average, hospitals have lost 4.2 hours. Now, this is just an average. So it could have been more hours, could have been less hours, but on average, this is the amount of time they were out of power. In 2016, we had a historic flood here. The operations at close 20% of all Louisiana businesses were disrupted, suggesting potential impacts on healthcare facilities. There was an increase in ER visits during these disasters. So here's a little case scenario activity. A hurricane knocks out power. You're sitting with a confused fall risk patient. What do you do? Of course, you're going to stay calm. You're going to reassure the patient. Call for assistance because remember, you do not leave your patients. Avoid leaving the room. Avoid panicking or moving the patient unless told. In chaos, do the basics. Stay calm. Stay with the patient and communicate with them. So I've included some disaster response checklists that we can go over. So before a storm hits, make sure you know your facility. You know their operation plan. Pack your personal to-go bag, and we did go over this a little bit earlier, but I put it in here again because it's very important. Make sure you have your ID. I just keep going back to Katrina. There were so many people that weren't identified, and it took them a very long time to try to identify those people. Have a change of clothes, have a charged cell phone, and a backup charger. Water, some non-perishable snacks. That's very important. I remember working for an OB doctor at the time, and there were a lot of patients and a lot of moms that weren't able to feed themselves or feed their kids. A lot of them did not do breastfeeding, and those that were doing breastfeeding were able to feed their kids. But having some non-perishable snacks, these are things you can order. It's really critical that you start looking for something that you can have just as backup for those times, those desperate times. Personal medications, you want to make sure you review the chain of command and know your assigned role. Check with your supervisor about patient-specific needs. Make a communication plan with your family, like your child care, transportation, who's going to pick up who. During the disaster, stay with your assigned patient unless instructed otherwise. You want to keep patients calm and reassured using a soothing, calm voice. Monitor for signs of distress, confusion, or medical changes. Remember, your patients feel safe, or at least they should feel safe with you. So they're going to be looking to you for certain things. So make sure you're paying attention to if they're in distress. Document medications, what time they were given, and report due medications. Ensure the patient is covered and safe. Make sure you remember the fall risk precautions. You're going to use your PPE as required, especially during flood or infectious exposure. Conserve battery power devices and flashlights. And follow the fire or evacuation protocols, the RACE, if a fire occurs. If power goes out, we have another checklist. Notify the nursing staff immediately. Avoid opening windows unless directed. And check patient equipment like oxygen, suction, IVs, call lights. Reposition patients to maintain comfort if beds lose function. Also check with the patient's family about pets, because sometimes the patients have, especially the elder patients, they have emotional support animals. So they should have like a kennel or something. Just because a disaster strikes doesn't mean that you can only look out for that patient, but that patient has that emotional support animal for a reason. So make sure that the animal is, put securely away in a kennel or something where the patient can also keep that with them. After the disaster, continue to monitor and reassure your patient. Constantly check on them, how you're feeling. Make sure you're watching for certain signs. Report any changes in the patient condition immediately. Replenish supplies if possible, like gloves, linens, wipes. Participate in debrief with team so that you can get those updates. And note lessons learned for future preparedness. So try to learn something from every situation that I encounter and take that into the next. So make sure you're paying attention to that so that you can better prepare for if there's a next time. And some final reminders. You are vital in keeping patients safe and calm. Know your plan, pack your bag, and protect your mental health. Ask questions now. Don't wait for a disaster. Preparedness is not panic, it's protection. Thank you, and until next time.